Just ahead on Health News Update, could some popular weight loss drugs lead to an unwanted side effect? What you need to know. And the non medication treatment that could help millions of women battling hot flashes. And feeling foggy? The surprising brain boost that may be hiding in your pocket right now. Those stories and more medical and research headlines coming up next on Health News Update. Hi, I'm Miranda Kahn with your Health News Update, where we bring you the latest in medical research from scientific journals and leading research institutions. We begin with what is a major shift in how we think about health, and it all begins with what's on our plates. So, for decades, the food pyramid shaped how Americans thought about eating right. But new federal health officials are challenging that long-standing advice and rewriting it in a way that may surprise you. So, what does that mean? Well, it means you may want to forget that low fat, high carb approach that you've been told to abide by for years. The Department of Health and Human Services just updated its dietary guidelines, and now it places greater emphasis on protein. That includes meat, even whole fat dairy, while urging Americans to cut back on highly processed foods and added sugars. Health officials say this represents a significant departure from the old food pyramid and reflects changing science around metabolic health and satiety. Officials stress this doesn't mean one diet fits everyone. The focus, they say, is on real, minimally processed foods and talking with your doctor or a registered dietitian about what makes the most sense for you. And as nutrition advice evolves, so are weight loss medications. For a lot of people, that includes GLP-1 weight loss drugs like Ozempic, Wegovy, and Zepbound. But doctors say that use could result in an unwanted and not widely discussed side effect. A new report from Medscape is raising questions about a possible link between these drugs and anemia. Experts say while these medications can significantly curb appetite, for some people that could result in not getting enough iron or other key nutrients. Over time, that can lead to anemia, which can cause fatigue, weakness, and shortness of breath. However, it's important to note that many people who take GLP-1 drugs already have conditions that can raise the risk of anemia, making it harder to pin down a single cause. Experts say this doesn't mean people should stop taking their medication, but if you're on a GLP-1 drug and feel unusually tired or run down, it's worth checking in with your doctor. And while medications are designed to help, how they're used also matters, which leads us to a new warning about testosterone gel, a common treatment used by men with low hormone levels. As reported by Medscape, the gel can sometimes rub off on others through skin contact, and in one case, doctors say a young girl developed male-like features after unknowingly coming in contact with someone who used the gel. Experts say these cases are rare, but the risk is real. Men using testosterone gel should wash their hands and keep treated areas covered. Doctors say when used correctly, the therapy is safe, but simple precautions can protect the whole family. Now to a story focused on relief for women going through a major life transition. So for millions of women, hot flashes can take over daily life, sleep, work, and even disrupting simple moments. In fact, up to 8 in 10 women experience hot flashes during menopause. And for many, they can last for years. But not all is lost. New research published in JAMA Network found a surprising option that helped cut hot flashes by almost half. And get this, it's not medication. The results showed that women who use guided hypnosis just 20 minutes a day saw their hot flashes drop by again nearly half. This included how often they happened and how severe they felt. Researchers say the practice helped women calm the body's stress response, offering real relief for some women who can't or don't want to use hormones. Doctors say hypnosis isn't a cure, but for women who feel that hot flashes are just ruining their lives, it may be a low-risk option worth asking about. And speaking of how the brain responds to stress, new research is changing how we think about mental health. When it comes to mental health, many people don't just fit into one box, and new research may help explain why. In a major genetic study of more than 6 million people, researchers found that disorders like depression, anxiety, PTSD, schizophrenia, and substance use disorder share some of the same biological roots. And they say that overlap means that the same genes can influence more than one condition. This may help explain why people are often diagnosed with multiple disorders and why symptoms can look different from person to person. The study, published in Nature Genetics, is significant because it could lead to more personalized treatment and help shift how we think about mental illness altogether. And sticking with the brain for a moment, this next story is a little unexpected. In fact, it's kind of wild. The next time you're chewing gum, you might actually be doing your brain a favor. Scientists at a university in Poland just took a deep dive into what happens in your brain when you chew, and it's fascinating. They found chewing actually spikes brain activity and triggers areas linked to focus, alertness, and stress. While that may be a sign of relief to you, then is warned too much chewing can also be tough on your teeth and your jaw, especially the sugary kind of gum. From adult brains to growing minds. When you take into account school, sports, friends, and after school activities, kids today are busier than ever. And with all of that going on, it's not unusual for them to feel stressed or overwhelmed. So, how can parents tell when it's more than just a bad day? And what can they do to help?
I think it's important to realize that stress is going to be involved throughout life, right? So a child goes on to grow up, and there's always kind of a next phase, and so there's going to be stress throughout life, and it's important that children kind of recognize that and learn to manage it as opposed to try and avoid it.
Dr. Kate Eshlin says stress can show up in different ways for kids, including changes in mood, interest, or even school performance. So, if you think your child may be struggling, she recommends starting by acknowledging what they're feeling, then working to identify what's causing that stress and how to manage it together. For some families, that may mean rethinking how homework is organized or helping kids prioritize their time differently. For others, it could be as simple as adjusting daily routines, making sure there's time built in for nutritious meals, downtime, and enough sleep. And whether your child seems stressed out or not, Dr. Eshlin says one thing always makes a difference: keeping the lines of communication open.
I think it's really important to communicate with your kids, and this is a good rule of thumb about anything, right? But get in the habit of asking about their day, asking about practice, communicating with kids so that if something comes up, they're going to be more likely to tell you.
And if you're not sure how to help your children manage their stress, experts say a good first step is reaching out to your pediatrician. It's a health issue that affects millions of women, but isn't talked about nearly enough. And if you're a woman and have ever noticed that your hair is thinning or seen more of it in the shower drain than you'd like, you're definitely not alone. Experts at the Mayo Clinic say up to 4 in 10 women will experience noticeable hair loss by the age of 50, with approximately 50% by the age of 70. And while there are many factors that can lead to hair loss, there are options that can help slow it down and, in some cases, help hair grow back.
What woman doesn't want thick, luxurious hair? The reality is,
More than half of women will have hair loss by the time they reach the age of 70.
Dr. Lisa Draghi says several things can cause thinning hair, including pregnancy, menopause, medical problems, certain medications, your genetics, and even stress.
The most common causes of hair loss in women would be female pattern hair loss, and that's a type of genetic and hormonal hair loss.
What can you do about it? Well, Dr. Draghi says that depends on why you're losing your hair. But for the most common form of hair loss, over-the-counter medications such as minoxidil works for about 2/3 of the women who use it.
The tough thing about hair loss is it takes a while for anything to really have a effect.
From 6 months to a year, there are also prescription medications that target hormones in your scalp, but no treatment is perfect. Dr. Draghi says research into managing female pattern hair loss is ongoing.
And if you notice your hair is thinning, the first step again is figuring out what's causing it and talking with your doctor. Today, we're continuing our 7-part series on diabetes from the Centers for Disease Control and Prevention. It's about simple, real life steps to help you or a loved one manage diabetes. One of the most common questions people ask after a diagnosis is this: what can I actually do that makes a difference? And this next video, the CDC focuses on movement and how even small amounts of activity can play a powerful role in managing blood sugar and supporting your overall health.
You've got diabetes, so you've probably got questions. Watch this 7-part series for answers to help you kickstart living well with diabetes. We've all heard that being physically active is good for us. That's even more true if you have diabetes. Being active is one of the most powerful tools you can use to manage diabetes every day. By being active, you can lower your blood sugar, lose inches and fat, boost muscle strength and heart health, lower your blood pressure and cholesterol, enhance your mood and feel less anxious, help your body's insulin work better, and even add years to your life. That's a lot of health benefits. To get those benefits, you don't have to spend hours at the gym. Being active means moving your body more and spending less time sitting. Start slow. Get up for short activity breaks. It all helps. In time, you'll be ready to do more. Add some simple activity into your day. There are lots of choices. You could walk your dog, garden, do housework, try an exercise video, dance to your favorite song. And when you're at work, take a walk at lunch, exercise in your chair, or take the stairs. For many, the hardest part of being active is making it a habit. Getting on a schedule helps, and is especially important if you take diabetes medicines, since being active and taking medicines can both affect your blood sugar levels. Here are a couple other things you can do to start small and keep going. Take it slow. Start with 5 or 10 minutes of activity and work your way up to 150 minutes a week or more if you can. Aim for 30 minutes, 5 days a week. Don't overdo it. While you're active, you should be able to talk, but not sing. Check your blood sugar before and after being active. Keep track of your activity. This will help you learn how it affects your blood sugar. Find a friend to be active with. It'll make it more fun and is great motivation. Now, make a plan and create a schedule to get active. If you haven't been active for a while, talk with your healthcare team about getting started. They can help you figure out what activities might be right for you and if there are any you should avoid. Your next step? Ask your doctor to refer you to diabetes self-management education and support. You'll gain in-depth knowledge and skills to manage diabetes for a long and active life. Ready to learn more? Watch the whole series and kickstart managing your diabetes now.
Next week, we'll take a look at why paying attention to your numbers and knowing what they mean can help you take more control of diabetes day to day. Coming up, tips to help keep your brain healthy throughout your life.
You're watching Health News Update, where we bring you the latest headlines from scientific journals and research institutions, medical breakthroughs, lifestyle tips, one-on-one interviews. You'll find it all on Health News Update.
Welcome back. More than 6 million Americans have Alzheimer's disease, a condition that can rob loved ones of their memories, personalities, and lifestyles. But as our guest today tells us, there are many new treatments today that can help people with Alzheimer's stay healthy and connected. And that's where I'd like to welcome in Dr. Mark Agroran. He is the Chief Medical Officer for the Mind Institute at Miami Jewish Health. Welcome, Doctor. What can older adults do to stave off cognitive decline?
It's important for every aging person to realize that it's not just about cognitive decline, that there's a lot we can do to actually improve or maintain our cognition. And it really comes down to what we call brain healthy lifestyle. And it's the basics: physical exercise, keeping our minds active socially and mentally, and making sure that we attend to all of the health issues such as high blood pressure and diabetes, high cholesterol, that not only can be harmful to our heart, but in turn can be harmful to our brain. These are the basics. Now, there's lots of other lifestyle changes we know are part of a brain healthy lifestyle, such as diet, something like a Mediterranean diet, making sure that our hearing and vision are improved, having a sense of purpose. So the list is generally long, but I think if people stick to the basics and really try to optimize those things, they can really not only maintain but also improve their cognition.
Oh, that's wonderful to hear. So, suppose someone is already having memory difficulties. I mean, are there any treatments and lifestyle changes that can help?
If someone is experiencing changes in memory or other cognitive skills, such as difficulty coming up with words, they're just more forgetful at times or finding themselves more disorganized, either they notice it or someone else notice it. It may just be a normal part of aging, but it also can sometimes be an indication of some underlying disease state or even a neurocognitive disorder. So my suggestion always is to start with your primary care physician if you're concerned, to make sure you have a good physical exam, that your labs are checked, that you just have a generally good medical evaluation to make sure there's nothing acute that may be causing some of these changes. For changes that are more persistent, they're more of a nuisance, it's really important for someone to see a specialist. And this may be a neurologist or a geriatric psychiatrist.
Yeah. So, caregiving, though, for a person with dementia, I know personally can be difficult to say the least. What do you advise to help caregivers cope?
Keep in mind that currently over 6 million Americans have Alzheimer's disease, which means there are at least 6 million caregivers for every one of these individuals. That's a lot. So many aging individuals, often aging spouses or adult children, find themselves in the role of a caregiver. And we know that it's a lot of time, a lot of work, and there's a burden associated with it. Caregivers suffer from increased medical issues, increased rates of depression, even increased rates of mortality. So we have to take this seriously. We need to support caregivers in every way. And I would also add that caregiving also can bring people such a deep sense of purpose and meaning. And so we don't want to only look at it from a negative perspective. What I remind caregivers is they need to take care of themselves along with the person that they're also caring for. This means making sure they tend to their own medical uh, health, mental health issues, that they have time for themselves, respite time we know can make a big difference, and that they work in partnership with a specialist who is caring for the person they're caring for, because there's a process of education. The more they understand the disease state, the more they can get counseling from someone, get support. It makes all the difference. We encourage every caregiver to be involved in some form of a support group, some sort of program to have other people who are walking in their same shoes that they can learn from, that they can support as well. These approaches can make all the difference for someone.
Great advice. How important is adult daycare for both the patient and the caregiver?
So one thing that's clear, whether someone has mild, moderate, or even more advanced changes in their cognition, which we see in something like Alzheimer's disease, people tend to progress slowly but steadily through different stages of cognitive impairment. It's important for everyone to have some regular cognitive and social stimulation. The same way that we stimulate our bodies and get exercise, we also have to keep our minds active and involved in meaningful activities. Daycare can be a part of this for some people. Most daycares are focused on individuals with more advanced symptoms. And so for caregivers in earlier stages, daycare might not be a good match for them. It might not be the best option. Sometimes we almost have to create like a day program in the home for someone or within a family group or in a community to make sure that they're busy and active in doing things.
Yeah, Alzheimer's is known, if I'm being honest, as that long goodbye. And with the diagnosis can come fear and grief and so many other emotions. So, how do you counsel the families about the journey?
By definition, Alzheimer's disease is a slowly progressive brain condition, which means that from the start of symptoms, it can unfold over a decade or more on average. So it's a very, very long process. I tell people it's a marathon, it's not a race. And it's variable. There are individuals who progress very, very slowly and really live out a normal lifespan. There are others who progress more rapidly. And both for the person who is going through this, it brings up lots of different issues in terms of changes in their role and their identity. A lot of people get associated symptoms of anxiety or depression. And for caregivers too, there's a sense of grief over what they're losing, what's changing over time. But what I tell people, and this is why it's so important to work with a specialist and especially work with a memory center, is that things are changing now. We have better early detection. And what that means is the earlier we detect it, the more we can get treatment going sooner. We have new ways to detect it earlier. We have new immunotherapies on the market that can slow the course of the disease, but they have to be implemented in the early stages. So with all this information, when I meet with people, I promise them our support at our center. And I want to instill both a sense of normality, that they keep living their lives as before, making adjustments as needed, given some of the cognitive changes. And I want to give them hope, because with new treatments, we know we can slow it down. I'm convinced that the more we involve someone in active living and they have a sense of hope and a sense of purpose, this also can impact the disease and slow it down.
So, last question, doctor. I want to ask you, what is the most important thing to remember when dealing with Alzheimer's disease today and in the future?
We have them get them in a brain healthy lifestyle so they feel better physically and mentally. And anytime there's changes in mood or behavior, we address and treat those quickly, because it makes all the difference in terms of quality of life. So if you put all this together, my main message is that we need to have hope for all the different things we can do for someone, but we need to intervene early. That's really key. There's so much we can do for individuals today with Alzheimer's disease, so much we can provide in terms of support, that when we put all that together, it can really improve the course over time. And I'm convinced, now that we can slow the course of it down, that we will reach a cure within the not so distant future.
Love that. Such encouraging news. Doctor, thank you so much for joining us. That's a look at what's making headlines in the world of health and medicine. Tune in to our health news update every week to get the latest from scientific journals and research institutions. I'm Miranda Kahn. I'll see you next time.